Lessons of an Audit from a CRA Perspective. This module should provide you with some insight as to the impact of staff turnover and audits on the job as a clinical research associate. The objective is to give you some strategies to consider. We'd like to ease the stress of staff turnover and help make your audits more successful. Let's start with staff turnover. There are many reasons why staff leave: budget cuts, staff relocation due to family changes, staff promotions, dismissals, retirements, and so forth. Staff transition is inevitable. What can the remaining staff expect? To be sure, there will be some stress, but there will also be opportunities. You and other staff may have increased workload and even longer work hours. Staff turnover may affect your budget due to the extra hours needed to cover the work and train new staff. Ultimately, staff turnover causes the shoulds to be missed or delayed and invites errors. This is definitely a negative impact. However, on the positive side, bringing in new staff provides an opportunity to improve your programs or procedures. New staff are in a great position to question how things have been done in the past and to offer new, refreshing approaches to managing the work. Have you already been through a SWOG audit? If not, you might ask, what is the purpose of it? Its aim is to review the accuracy of the data you have submitted, to verify that your site is in compliance with protocol and regulatory requirements, and to provide your site educational support regarding data quality or quality assurance and data management. It's a great learning opportunity and can only help make your data submission accurate and complete so the protocol can ultimately be evaluated honestly. The SWOG audit process is not meant to be punitive or mean-spirited. Even knowing that an audit is being done with the best of intentions still will create some anxiety and your staff will notice it. So, what is to be expected? Well, first of all, be prepared. You have charts and regulatory files to pull. If you have a large program, you may have to pull many files. Get started early. In an ideal world, you should always be ready for an audit. Granted, that may not be possible every day, but attempt to do so. As a starting point, you can refer to the SWOG Workbench link. Select the ORP Manual, Chapter 1, Audits. Then select the Policies and Manuals link, reviewing policy number 19 on the Quality Assurance Program, and finally the QA/Audits link for the checklist. Keep these documents handy at all times, and be sure each protocol, each patient chart, and each regulatory memo is properly documented. The SWOG audit team will provide you with a list of patients about 4 weeks prior to the audit, and one or more patients may be selected on the day of the visit. These are the patient charts and regulatory documents you will need to prepare for the audit. You definitely want to alert and include all your CRAs, physicians, nurses, pharmacies, and research subject review board that there is a pending audit and their participation may be expected. Pull your patients' charts, scan reports, drug logs, and regulatory files ahead of time. Go through them using the SWOG audit preparation checklists. Find missing information, but do not falsify it if not present. For example, do not make up a telephone call to a patient. SWOG has a suggested color code to use to tab each chart for their review. For example, all red tab sections equal labs and all blue tab sections equal scan reports. By all means, audit every chart yourself and create an internal audit team to include the CRAs, research nurse, and PI. Once again, use the audit checklist and review patient eligibility. Check the dates on your consent form against the Research Subjects Review Board approval dates. Make sure patients received supplied study drug if applicable. Ensure dose modifications were done correctly and that the test schedule was followed. Make sure all data is up to date and correct. Even more, conduct self-audits by having the CRAs exchange their patients and studies. This not only provides a second pair of eyes to review, but creates an additional learning opportunity if the CRAs don't regularly manage those particular protocols. Host an audit workshop. If you have affiliates, or if you are an affiliate nearby, Switch charts. The ultimate goal is to incorporate self-audits throughout the year as an ongoing quality assurance. Set up a quiet room for the auditors. Provide office supplies, view box, etc. if needed. Furnish snacks, refreshments, and/or lunch if possible. In short, make the auditors comfortable. If you have a lot of patients to review, a suggested layout would be to put your patient's chart and associated regulatory documents in a stack laid out on a table in the same order as the audit list. Put a cover sheet on top of each stack. Write in bold and in big font the case number, study number, and patient number on it. This way the case is easy to identify as several auditors may be sharing the documents, and the cover sheet will hold a place for them to return to. The auditors know what they are looking for. What you consider a mistake may not be on their list. It is not necessary to point out errors. They will find them on their own if significant. The auditors prefer that the affiliates send their files to the main member's site, or someone from the affiliate site should try to be present on the day of the audit unless other arrangements have been made. The wrap-up session is very informative. Have as many involved staff attend as possible. Just remember that this is also a learning experience, and it can only help you manage your protocols and charts in the future. Learn from the audit. Make your procedures even better. So, what do we usually experience from an audit? Again, there will be some anxiety. A poor audit can affect your future funding or grant renewal. If it is really poor, you may be suspended from enrolling more patients until changes are made. Finally, if there is any misconduct, the institution may be barred from future government-sponsored research. On the other hand, the result of an audit will reinforce the notion that we need to ensure that the shoulds should happen. At the end of the day, all an audit merely does is examine that your work and records are in good standing. It also suggests ways to improve both. Should staff turnover and an audit coincide, inevitably there will be some worry. Staff turnover and audits can be related. Staff departures or changes may cause the shoulds to be missed or delayed. But audits will make one aware of the shoulds that need to happen. Look at audits as opportunities to straighten out the house. Standardization is one strategy to help reduce the stress of training new staff and participating in audits. For example, ensure all your patient charts are clearly flagged to identify patients that are on study. Something as simple as a very bright sticker or a post-it note on the front of a chart with pertinent study information on it should help certify that study-related tests and procedures were attended to on visit day. Another strategy is to place a bright-colored 8.5 by 11 sheet on the inside cover of the patient chart on visit day. Include an outline of expected study/patient information to be reviewed at the visit. Go over official orders that would have been fulfilled, labs, scans, etc. Make sure your patient screening logs are in good detail. If you maintain a regulatory binder for each protocol, coordinate all your regulatory binders using the same color binder for all protocols. Organize the inside of the binder in the same order for all protocols and tab them accordingly. Keep your individual study-specific binders arranged uniformly with just the necessary info one needs. Document everything as if the chart was being audited today. Make everything very clear and legible so another individual can easily understand it. Get rid of all those random extra copies of protocols and consent forms. Maintain a central master or online access copy to assure only the most up-to-date approved version is being used. Conduct internal audits among your staff CRAs. The more you standardize procedures and documents within your program, the greater the likelihood you will have good documentation and successful audits. It also makes it easier to train staff and to cover for each other when one or more staff are absent. These are examples of some of the things you can standardize between protocols. Study startup process, core chart setup, medication logs, clinic chart flags for on-study patients, informed consent process standardized such as forms, filing procedure, etc. Online information regarding consents and protocols, billing for study versus standard of care. Document these items carefully: eligibility criteria, dose modifications, adverse events, etc., chemo orders and prescriptions for study medications, drug accountability for study medications, mistakes and changes to forms. Be meticulous with your documentation. Cross out, date, and initial any mistakes. Others will be reading your entries. Make them clear, concise, and understandable, not just for you, but for them as well. Simplify. Too many copies creates chaos and sometimes causes the incorrect version of a form to be used. For example, consent forms, case report forms, protocol versions, etc. Destroy copies and excess to ensure that the correct version of a form will be utilized and make the regulatory burden easier. Other suggestions to limit copies and clutter. Put study documents online if possible, or place hard copies in one central regulatory study folder. Use only the primary source document and pull as needed. Keep copies of blank CRFs out of the chart. Go to the website to submit online or print off the current version as needed. Use only your most up-to-date IRB-approved protocol version. If you use a local IRB version, there may be a lag time between the online version and your approved one. Remember, audits are management tools. Learn from them. Stay the course and good luck on your endeavors.